Namaste. Breast health awareness is a vital part of how you stay healthy. Most women experience some form of breast changes, and it's important to know how normal your breasts are and to keep an eye on any changes. And if there are complications, you should contact your health provider. That said, breast cancer is one of the most common condition in the world. Improvements in awareness programs and research worldwide have contributed to the development of technologies for treating breast cancer. But some changes in lifestyle and regular screening may help us prevent it. It's vital to be informed about the condition, its symptoms, and preventive measures, and which is why we're very happy to have with us today our expert, Dr. Krishnaswamy, breast and oncoplastic surgeon at Apollo Hospital's Greams Road, Chennai. Thank you very much for joining us today, Doctor.
Thank you.
Let's start by asking what is breast health and how important is it for women?
Breast health is a holistic concept. Rather than talking about the breast in terms of disease, we are looking at the breast in a holistic way so that we take into consideration what is both normal as well as what is abnormal. And this way, one can prevent what is abnormal. So I would say that breast health is a concept that all women must be aware of right from the time of puberty on to their postmenopausal age group of old age. The whole spectrum of changes that take place in the breast is completely subsumed by the word breast health.
So, when we say common problems relating to breast health, what do we intend to speak about here, Doctor, during this session?
There are many problems that women face vis-a-vis the breast. The most common problem that we face is pain in the breast. The second problem that we face are lumps in the breast. The third problem is discharges from the nipple. And finally, we come across size and shape abnormalities of the breast.
And what measures, Doctor, are helpful in keeping breast health intact for women?
The concept of maintaining breast health has to start from childhood onwards, particularly in girl children. They have to be told about the changes that happen in the breast from puberty onwards so that these changes don't come to them as a rude surprise. And they need to accept these changes as part and parcel of life. The most important aspect, which a lot of women ignore, is diet. A low fat diet, preferably a traditional diet, which is preferably organic, would be the right way to start. And particularly in teenagers, I think there has to be a lot of awareness built up about junk food. And this, I think, is the basis for breast health. Secondly, I think it is important that the girl child or the young woman maintain an extremely active lifestyle, making sure that they get plenty of exercise and fresh air. I think this is the second aspect of maintaining breast health. The third aspect is being breast aware. Every woman must be familiar with the texture of her breast. If there is some change in the texture of the breast, then the woman should be able to identify it and take help from their healthcare provider.
So, speaking of issues concerning breast health, Doctor, what are the treatment methodologies available today and what are the conditions that can be treated?
So, There is a wide spectrum of breast problems that we surgeons come across. But it is important to note that there are problems such as breast pain that are treatable by just lifestyle changes. There are certain problems of pain which are treatable with mild medication, which is not going to cause any side effects. Lumps in the breast will necessarily mean surgery sometimes without distorting the appearance of the breast. And sometimes it is possible to simply keep an eye on the problem because it might go away on its own. And lastly, I think it is also important to remember that if there is a serious problem in the breast, then surgery, chemotherapy, radiation, biological treatments, these are all options that can be very successfully utilized.
Speaking of the most concerning breast health condition or issue that women face, breast cancer. Could you please explain what breast cancer is all about, doctor?
Well, breast cancer, unfortunately, is the most common cancer that Indian women face today. And a cancer is basically an abnormal growth which completely takes leave of the control mechanisms within the body that regulate cell growth and multiplication. So, this is really a wild card which appears, which causes these cells to proliferate at the cost of the entire body. And they have this remarkable ability to spread throughout the body. So little pieces might break off and go and lodge themselves elsewhere in the body where they are nourished by the blood supply, and the surrounding tissues suffer for lack of blood supply. So, this in short is a breast cancer.
Are there different types of breast cancer, doctor? And if yes, what are they and how do they differ from each other?
Breast cancer is a huge spectrum of pathological problems. On one end, we have the precancerous stage. Next comes the breast cancer per se. And some of these cancers are very indolent, very slow growing, hardly troubles the lady in any way at all. And then there are, of course, these aggressive forms of breast cancer, which progress very rapidly and they become rather difficult to control. So, there are pathological varieties of breast cancer. Some of them behave well, some of them are not expected to behave well. But then, in this day and age, we have so many options for treatment that many of the cancers which we thought were quite virulent are easily controlled in this day and age.
Thanks to technology, of course.
Thanks to technology.
Doctor, if that's the case, what are the symptoms that a woman should look for? Could you let us know on that?
The most important problem that a woman might face when she develops a cancer in the breast is a lump in the breast. But I'd like to make it very clear that even before a lump forms, these lesions can be picked up on mammograms. And it is important to realize that by the time a lump has formed, it is actually quite late in the life cycle of a breast cancer. The second common feature is a discharge from the nipple, which is usually very heavily blood stained. Thirdly, some women notice some minor abnormality in the nipple, such as an indrawn nipple or a nipple that is not pointing in the same direction as the opposite side. And of course, there can be skin changes. There can be dimpling, there can be some sort of discoloration of the skin. And rarely, there can also be lumps in the underarms adjacent to the breast. But the most important thing to note is that there is seldom any pain with breast cancer.
So, self examination is the key.
So, if we need to pick up breast cancers fairly early on, then the easiest option for every woman to adopt would be to do a self breast examination every month without fail, preferably after her periods, approximately 1 week later. And of course, after the age of 40, the patients can go in for annual mammograms or mammograms done every second year if the previous mammogram was normal. Obviously, if there is a family history of breast cancer, one has to take some extra precautions in order to identify any problem that might creep in silently.
Doctor, one of the most asked question on the internet: what causes breast cancer? Why me?
Why me is a very legitimate question, and I wish experts had the answer to what causes breast cancer. We are yet to crack that puzzle. We assume that there is a genetic component, but that may be contributing to very few breast cancers, perhaps about 1 or 2% of breast cancers. The answer, therefore, is the causes of breast cancer are largely unknown. One does suspect that the environment has a strong impact on the development of breast cancer, but what those problems are and how we are to annul them is still a mystery that we are trying to unravel.
Do men also fall prey to breast cancer, doctor?
Unfortunately, yes. A small percentage of breast cancers do occur in men, particularly men who have enlarged breasts, which often happen at a later stage of life. But this is something relatively rare compared to a woman's problems.
So, who is more at risk of getting breast cancer, men or women?
Well, women are clearly more at risk of getting breast cancer. And as I stated earlier, Indian women, breast cancer has become the leading cancer, which is a very unfortunate statistic to have to repeat.
Doctor, you mentioned that breast cancer could be hereditary. Could you elaborate a bit on it, please?
A very small percentage of breast cancers are hereditary, and it is only now that the genetic aberrations have been unraveled by scientists, and today we have certain genetic tests that are available routinely in our country, and these are referred to as BRCA1 and 2 genes, for which we can test certain women. It is not necessary to test all women for this genetic abnormality. There are certain strong indications in a given woman which will prompt your health caregiver to order these tests. And if these tests turn out to be positive, then we know that this individual is at higher risk of breast cancer and we can take preventive measures for it.
Doctor, do environmental factors cause breast cancer?
The answer to that is yes, environment seems to play a large role, but how exactly it impacts and what the mechanism is, we still don't have a clear idea.
We'll take some questions from our viewers, doctor. Um, is it true that breastfeeding reduces the risk of getting breast cancer?
The answer to that is breastfeeding does protect a woman from getting breast cancer. That is not to say that this is a given, but largely breastfeeding, perhaps for about a year or so, definitely protects a woman from having breast cancer. But the converse isn't always true.
I have also heard that prolonged breastfeeding is a risk factor. Is it true, doctor? If yes, what should be the optimal period that I should breastfeed my child?
No, prolonged breastfeeding is not a risk for breast cancer. Generally speaking, today the obstetricians and gynecologists usually encourage women to feed the child for as long as possible. But in today's lifestyle, where a number of new mothers are working, this tends to be curtailed due to circumstances. But if it is possible for the average working lady to feed the child for approximately a year, that will be a good balance to achieve.
Hello, doctor. I've heard that obesity is a risk factor for breast cancer. Is it true?
Obesity does seem to have some sort of an impact on the incidence of breast cancer, particularly in women who are postmenopausal. But what this mechanism is, we are yet to understand fully.
It was mentioned in a medical blog that I read, doctor, that a child who gets her periods before the age of 12 is more at risk of getting breast cancer. Is it true, doctor? Why does this happen?
This is partially true in that a young girl who gets her first period before the age of 12 does have a slightly exaggerated risk of breast cancer. But this is not to say that just because a girl has her menarche or her first period late is protected against breast cancer. These are all just trends that we talk about. There's no clear cut individualization of these risk factors.
Do chances of breast cancer increase if a woman gets her menopause at a later age?
Again, a late menopause correlates with a greater incidence of breast cancer, presumably because of longer period of estrogen exposure to that woman's body. But once again, not every woman who has a late menopause gets breast cancer, and not every woman who gets her menopause early is protected from breast cancer.
Coming to the next most asked question, doctor. Is breast cancer curable?
Breast cancer is curable in the very, very earliest stages, preferably when it is at a cellular level or it is in the precancerous level. A very early breast cancer, I'm talking about something that is less than 10 millimeters, is potentially curable. But that doesn't mean that larger breast cancers are not curable in that sense of the word. They are controllable, and a woman can expect to live a normal span of life.
What are the treatment options available to treat breast cancer today, doctor?
Well, the most important option, of course, is surgery. And there are very many varieties of surgery that can preserve the breast in terms of appearance. Secondly, there is, of course, the question of chemotherapy. And most of our viewers would have heard about chemotherapy being the backbone of successful treatment of breast cancer. And thirdly, we have radiotherapy, which again is extremely useful in controlling breast cancer. And today we have biologicals and targeted therapies which can be individually used in order to control breast cancer.
Doctor, you mentioned about surgical treatment of breast cancer. When is surgical removal of the breast itself required for the patient who is suffering from breast cancer, doctor?
Generally speaking, today the trend is to conserve the breast for obvious reasons. But occasionally, the cancer may be larger than is suitable for conservation, or it may be what we call multifocal, that is, it occurs in different parts of the same breast, in which case conserving the breast may not be an option. And therefore, removal of the breast may be the logical solution.
What about radiotherapy, doctor? How does it help?
Radiotherapy is usually given to the average woman who has had a lumpectomy or removal of the cancer preserving the breast. In order to mop up the cancer cells that may be lying in and around that area of surgery, we can use radiotherapy in order to kill those cancer cells. And today we have so many options for radiotherapy. In the older days, we used to use this external beam radiotherapy. Today, there are internal methods wherein radiotherapy can be offered to patients by burying radioactive material within the breast. So, this is a great advantage to the patient. And today, of course, many of your viewers will be aware of what is called proton therapy, wherein photons or light particles are generated. They are made to travel at about 60% the speed of light, and that helps to mop up not only the cancer, but it avoids many of the side effects of conventional radiotherapy.
So, what are the ways, doctor, to prevent breast cancer?
The most important aspect in prevention is to be breast aware, breast health aware, breast cancer aware, preferably in that order. I have already mentioned that one of the most important preventive aspects is a change in lifestyle. Eating a low fat, healthy diet, exercising regularly, trying to avoid additives, preservatives, chemicals in food, and not engaging in self medication or relying on medical solutions for what is eminently controllable naturally. These are all the lifestyle options that every woman has to be aware of. Secondly, of course, the cheapest way of being breast cancer aware and breast aware is to examine one's breast every month without fail from the time of puberty onwards when the breasts start developing. And this will help the woman to become familiar with the texture of her breast. Therefore, if there is a change, then the woman becomes immediately alert to the fact that there has been a change and that this needs to be attended to. Now, around the world, of course, there are many countries which offer population screening through screening mammography programs, usually in women well over the age of 40. In India, there is no such program, but a lot of women who have a family history of breast cancer can go through screening mammography as an individual choice. Now, these are the preventive measures that every woman can take.
Doctor, how often should a woman get a mammogram done?
A woman may start getting a mammogram done once a year after the age of 40. But if the last mammogram was normal and your healthcare provider deems that you're at low risk of breast cancer, even once in 2 years is more than adequate. And this can carry on till perhaps age 75 or so, after which I think it is left to the woman's discretion as to whether she wants to continue the mammography program lifelong or whether she wishes to rely on simply breast self examination.
What would be your message to our viewers today, doctor?
I think the most important message that I would like to share with our viewers is that breast health is the most important aspect in a woman's life in terms of health. Particularly in India, with breast cancer having leapt up as the number one cancer that women are going through, I think it is important for women to be aware of health of the breast, to be breast aware, and to ensure that they approach a healthcare specialist or a healthcare specialist as soon as possible whenever they notice that there is some abnormality that concerns them.
Thank you very much, doctor. That was a detailed explanation about breast cancer and the importance of breast health for women.
Thank you very much indeed.
For appointments with Dr. Krishnaswamy, breast and oncoplastic surgeon at Apollo Hospitals, Greams Road, Chennai, please contact 044 4040 1066. I repeat 044 4040 1066. Thank you very much, doctor. Thank you, viewers.